Welcome to the Introduction to Scholarly Research video series. This is video 3, PICO and formulating questions. By the end of this tutorial, students will know what a good research question entails, understand how question frameworks guide question formulation, and know and understand how to use PICO to formulate answerable questions. The first step in the research lifecycle is to create a focused research question. A good question is the backbone to good research. It will add a new perspective to current knowledge and aims to explore an existing uncertainty in your area of concern. It helps focus your searching and guides the type of information or data that you can go looking for. To form a question that is answerable, you want to use a framework that will help you focus your efforts. There are actually a variety of question frameworks out there, but the framework used most often in the biomedical and health fields is PICO. And what it's going to do is give you a structured approach to formulating your questions. You'll most often start with an idea or a topic or a concept that you want or need to look into, and your job is going to be to filter that topic or idea down into an answerable question. PICO and the other frameworks gives you a way to do that so that all the most important parts of the question are included, and it's done in such a way as it makes searching various databases easier. So PICO. The P stands for the patient population or problem that you want to talk about. The problem or condition being dealt with is going to be the easiest part to find, since the condition will most likely have lots of literature out there already. For example, you may be looking into autism spectrum disorder, which has tons written about it. But what makes questions unique are the specific populations that you look at as they relate to that condition, and so adding those relevant demographics is also important. You just want to be aware that depending on what's out there, you may be limiting yourself in what you find, so you also want to be careful with how those demographic terms are used. Again, using autism as an example, the majority of the existing literature centers around children. So if you're interested in autism in adults, you're cutting out a huge chunk and your results will be smaller. If your question needs to have that sort of specificity, then eliminating children from the results is necessary. If your question doesn't need to be specific in that way, then leaving the demographics out is also okay. I stands for intervention. What treatment, therapy, method, etc. are you going to use to try and address the problem? C is for comparison. What alternative methods are you looking at that may also address the stated problem? Are you looking to compare two medications, for example, or one type of community programming to another? This aspect of the question is not required. You don't have to compare your intervention idea to anything if you don't want to, so don't force it into your question if it's not there. This part can be left blank. O stands for outcome. What are the desired results that you're looking for? Are you looking for a reduction in symptoms, better cost effectiveness, lower rates of addiction, etc.? What are you hoping to achieve? You could also add the T, but that's also not required if you want to look at a specific time frame. All right, let's take a look at how you might go about forming a PICO question. Let's say that you're studying the cardiovascular system and have been learning about how heart-healthy lifestyles lower the risk of heart attacks in adults. You're curious if the practice of yoga would be just as helpful to patients as a more traditional exercise regime. Is movement or is more vigorous movement better? And what is the outcome for those at higher risk of heart attack? What you want to do is try and pick out each part of the acronym and use those terms to formulate a question. So in this case, our patient population are adults at risk for heart attack. The intervention we want to use is yoga, and we're comparing it to a more traditional exercise regime like running, weightlifting, that sort of thing. And the outcome we're looking for is decreased risk of heart attack. And from those terms, we are able to come up with an answerable question. We are looking to compare yoga and more traditional exercise to see the effects of each on heart attack patients. For more information on the individual parts of the process, you can view the complete series on the Medical Scholarship and Medical Databases LibGuide. Each tutorial is only about 5 minutes long and will give you a good overview of the entire scholarly work process. If you have any questions about any aspects of the scholarly work process, please do not hesitate to contact either of your health sciences librarians. Our jobs revolve around this exact process, and we'd be happy to help you through it. Thank you.